Hello, everybody. Greetings. Good morning, good afternoon, good evening. We'll just wait a minute to let people in, and then we'll get started. Okay. All right, we'll just, I think, do 30 more seconds, and then we'll get started. In the meantime, please feel free to put your name and organization and where you're dialing in from in the chat if you wish to. Okay, I think we can get started. So we're 2 minutes over start time. So, as I said, thank you everybody for joining today. Good morning, good evening, good afternoon, depending on where you're dialing in from, and welcome to today's session, coming to you from Concept Foundation on our recently launched request for proposals for Preeclampsia Diagnostics under the Supreme Secure program. If you can go to the next slide, please, Caroline. And before I get started, I'd like to introduce myself. My name is Petra Proctor. I'm a Senior Program Manager at Concept Foundation and the Operational Manager for the Secure Project Concept Foundation activities. I'm joined today by our Program Officer, Caroline Wanju, and also our Executive Director, Marta, who in a few seconds will be opening the session and providing some scene setting and framing remarks. Before doing so, I just wanted to quickly go over the agenda for today's session. We'll start with a brief overview of Concept Foundation for those of you who don't know us, and also another brief overview of the Supreme Secure program. And then we'll focus on the 2 RFPs or requests for proposals that we recently launched. PE 003 and 004. For simplicity, I'm just going to call them RFP 3 and 4. So we'll touch on the scope, use cases for each of these RFPs, target products, and the manufacturer commitments that we're expecting of manufacturers through the process and beyond. We'll also go over the key evaluation criteria that we'll be assessing proposals against, and we'll go over the overall timeline of the process up to the point of manufacturer selection and the key dates for different milestones. Ahead of closing, we'll touch on some of the questions that we've received from you all as you registered for this session, and then we'll close the session for the day. This session is being recorded and will be posted on the RFP web pages, as well as these slides that we're presenting today. So without further ado, I'm going to hand over to our Executive Director at Concept Foundation, Marta Fernandez-Suarez, who is going to provide our opening remarks. Over to you, Marta. Thank you.
Thank you, Petra. And good morning, afternoon, and evening. And thank you all for joining us in this information session on the 2 recently published requests for proposals. So just to give you an overview, these proposals and the subsequent partnerships that we are aiming to establish are seeking to close persistent gaps in access to accessible, affordable, and quality-assured tools for the prevention, the diagnosis, and the management of preeclampsia. These are part of the Unitaid-funded Supreme Secure initiative, which aims to improve equitable access to quality-assured maternal health products, both for preeclampsia and eclampsia, which are the focus of these RFPs, as well as maternal anemia across sub-Saharan Africa. Because I'm sure that all of us here today agree on one thing, which is no woman should die from conditions that we know how to prevent and we know how to treat. And I think we're all here aware of the urgency of the challenge. Preeclampsia remains a major contributor to maternal and perinatal morbidity and mortality, particularly in low and middle income countries, where the timely diagnosis and the referral are usually constrained by limited access to the appropriate tools. And this is precisely what we're trying to tackle with this initiative. But of course, innovation, while very important, is not enough. And in order to have public health impact, we need these promising diagnostics that you are all developing to be fit for the realities of the healthcare systems. They might be supported by evidence. They must be quality assured and affordable. And they must be registered, supplied sustainably, and adopted by the countries. So in this context, the two RFPs are intended to engage with manufacturers, with many of you, across complementary parts of the preeclampsia diagnostic landscape. We're looking for more mature assays that may be looking at the antigenic biomarkers, as well as earlier stage point-of-care technologies that are still in development that may be employing minimally invasive specimens. And Petra is going to describe those RFPs in detail for you. But before we move into the details of the RFPs, I just want to stress one thing, that the Supreme Secure Initiative is looking for partnership. This is not just about procurement, and Petra will answer some of the questions you all had. Our aim is to work collaborative through our consortium partners with selected manufacturers to generate the evidence, to strengthen the regulatory and market entry readiness, and to support pathways towards sustainable access. I also want to emphasize the importance of transparency, fairness, and the shared accountability in this RFP process, where the proposals are going to be reviewed through a competitive process and with an independent oversight. I encourage all of you to see this RFP process as an opportunity to collaborate and contribute to a broader market-shaping effort that can really help make these high-quality preeclampsia diagnostics more accessible to the women, the care providers, and the healthcare systems that need them the most. Thank you all for being here today, and importantly, thank you for your critical efforts and role in transforming maternal health outcomes through practical, affordable, and scalable diagnostic solutions. Over to you, Petra.
Thank you very much, Marta, for that excellent setting of the stage for today's session and for the work we're doing under Supreme Secure when it comes to preeclampsia diagnostics. Caroline, can I ask you to go to the next slide and then the one after, please? Wonderful. And one more. Perfect. So we thought we would give a brief overview of Concept Foundation for those of you who are new to our organization. Concept Foundation is an international not-for-profit non-governmental NGO. We are based in Bangkok, Thailand. So we have offices in Bangkok, Thailand, Geneva, Switzerland, and Nairobi, Kenya. We are more than 35 years old. We were established in 1989 by what's known today as the World Health Organization Human Reproduction Program, or HRP. And since 2004, we have been operating under a framework agreement with the WHO, and we continue to work very closely with the WHO today. Our mission, simply put, at Concept Foundation is to accelerate innovation and equitable access to quality assured and affordable sexual and reproductive health products that meet the needs of every woman and every girl. To reach this mission, we apply a systematic end-to-end approach to therapeutics and diagnostics access that spans the product development lifecycle, from early research, clinical studies, to supporting product development and manufacturing, specifically quality manufacturing, to downstream activities like regulatory approval and country-level market access. Our manufacturing and market access team, which is the team that you'll be collaborating with at Concept Foundation should you be selected through this process. This team provides bespoke, tailored technical assistance to manufacturers to enable sustainable access to quality assured and affordable sexual and reproductive health medicines and diagnostic tools in the countries that we serve, which is low and middle income countries all over the world. Within sexual and reproductive health, we work across three core thematic areas. These are abortion and contraception, maternal health, and women's health. So you can go to the next slide, please, Caroline. Thank you. Moving on to the Supreme Secure program, and we recognize this is a busy slide, so we encourage you to access the slides after this meeting to review this in more detail. But this program is a $25 million Unitaid-funded initiative to catalyze, designed to catalyze access to quality-assured maternal health products across sub-Saharan Africa. So as Marta mentioned, this program is really focused on two of the critical causes of maternal mortality and morbidity, which is preeclampsia and maternal anemia. Supreme stands for sustained uptake of products for preeclampsia and maternal anemia, and Secure, which is this specific project, stands for sustaining equitable care and universal resources for preeclampsia and anemia. The project kicked off this January. It is a 4-year project led by the Clinton Health Access Initiative and a consortium of partners. So alongside CHI, the Clinton Health Access Initiative, within the consortium, we have ourselves, Concept Foundation, and then we're also working with the Orem Institute, the Burnett Institute, and Wacky Health. And within that consortium of partners, every partner has a critical role, but I would emphasize that the Burnett Institute is also working very closely, specifically on this diagnostics work stream. We're working to increase access to a basket of therapeutics and diagnostics for both preeclampsia and maternal anemia in 5 focal countries. These are Ghana, Malawi, Senegal, Tanzania, and Kenya. And within preeclampsia and maternal anemia, we're focusing on recommended preeclampsia therapeutics and maternal anemia therapeutics, as well as novel biomarkers, cause of anemia biomarkers, hemoglobinometers, and blood pressure measurement. The project is designed across 4 key outputs, and these outputs are designed to work in some cases in parallel and in others in sequence. But essentially, the program is designed to generate evidence to address persistent product access gaps, knowledge gaps to support market entry and introduction of new technologies. We're also working to generate demand at the country level, country and regional levels by creating tools tailored for target populations to drive uptake of the new and underused products that we are focusing on. In parallel, we'll be working closely with manufacturers to increase product access, which are activities that we'll focus a little bit more on through this RFP as well, to address supply side barriers via direct manufacturer engagement and ecosystem improvement. And then last but not least, the program is also designed to work closely at the country level on country adoption and scale up to really ensure scalability and sustainability of the work that we're doing. So you can go to the next slide, please. Specifically from a diagnostics perspective, I'm just going to go over the rationale behind the work that we will be doing and how that links to the project output. So as Marta mentioned in her opening statement, today's reality is that preeclampsia remains one of the leading causes of maternal and perinatal morbidity and mortality. The highest burden is in low and middle income countries, and within that, sub-Saharan Africa. A critical reason for this is that diagnosis of preeclampsia and maternal anemia still relies heavily, specifically in the case of preeclampsia, on blood pressure and urine dipstick proteinuria, which does have significant limitations. So just to try and address these gaps, within the evidence generation output, we're going to be working on supporting laboratory verification studies for selected diagnostic tools, conducting multi-center clinical validation where applicable. We'll also be undertaking performance evaluation reports and also conducting operational research to inform deployment of diagnostic tools. We'll also be working with manufacturers to support regulatory readiness once the evidence generation work has been completed. So this includes verification and validation, study planning aligned to intended use of diagnostic tools, support on technical documentation, regulatory strategy, and also preparation of dossiers. And then thinking about downstream market access, we'll be working closely with manufacturers on developing target market regulatory strategies, also commercialization strategies and supply planning, as well as distribution training, installation and service planning, and also collaborating closely with manufacturers on access pricing and procurement engagement. You can go to the next slide. So we have launched 2 RFPs, or requests for proposals, in parallel. And we've done this because each is focused on a specific, distinct use case. RFP 3, which is focused on identifying manufacturers of mature angiogenic marker assays. The core intent of this RFP is to identify manufacturers that we can work with to conduct analytical and clinical evaluation of selected technologies and to generate evidence for global regulatory submission and national regulatory approvals. The use case of focus for these technologies is fixed on aid in diagnosis and short-term prediction from 20+ weeks of gestation in women with suspected preeclampsia. And we're targeting technologies that are design locked or near design locked, specifically for blood-based SFLT and PGLF assays. RFP 4 is focusing on a broader, minimally invasive pipeline. So specifically on the use case for early risk screening before 20 weeks, and or aid in diagnosis and short-term prediction from 20+ weeks. So for this RFP, we're targeting technologies that are usable at the point of care, biomarker assays using minimally invasive specimens, such as capillary, whole blood, urine, or saliva. And the core intent of this RFP is to support late-stage development, recognizing that most technologies for this use case are still in the development stage. So also supporting design optimization, verification and validation, also regulatory dossier development. Next slide, please. So before going through the specific commitments that we are expecting of manufacturers for each of these RFPs, and as I've already mentioned, but just to be very clear on what the key differences are for these 2 RFPs, is first and foremost the assay that we are targeting. So for RFP 3, this is really specifically focused on SFLT and PGLF assay, whereas for RFP 4, we're targeting a broader range of minimally invasive specimens. The use case is a critical difference as well. Again, RFP 3 is focused on aid in diagnosis and short-term prediction from 20+ weeks, whereas RFP 4 is also targeting early risk screening before 20 weeks, as well as aid in diagnosis from 20+ weeks. Also, the expected activities that we plan to conduct with manufacturers are different between the 2 RFPs. So for RFP 3, we're looking to work with already close to design locked technologies to support evaluation studies. And then for RFP 4, we're looking to support late stage and advanced development of late stage development, support validation and verification, and also work on documentation towards establishing regulatory readiness. You can go to the next slide. For RFP 3, as already mentioned, we're expecting manufacturers who submit proposals to be able to confirm their products are design locked, or at least demonstrate a credible plan to achieve design lock by the end of this year, so 31 December 2026. We will then need manufacturers to be able to rapidly manufacture 3 lots of their design locked assay and supply sufficient materials to support the analytical and clinical evaluations, which Burnett Institute, our partner, will be leading on in collaboration with the manufacturers, with yourselves. Manufacturers are required to provide the assays, consumables, devices, controls, and technical documentation for the multi-center clinical performance studies in the target countries. We also expect manufacturers to be able to collaborate closely with the study teams, including supporting on protocol questions, troubleshooting during the process, and review of preliminary data. We'll also be planning to conduct quality inspection of the manufacturing site in line with ISO specifications, and as well as all of the technical activities that I just described, we are also expecting to collaborate with manufacturers on target market access pricing, country registration in the target markets, commercialization planning, etc. As mentioned earlier in the presentation, to support regulatory and regulatory approval and market access. So that's the specific commitments expected for manufacturers who are applying for RFP3. Next slide, please. So for RFP4, what we're expecting of manufacturers is to be able to work with us and conduct product development or design optimization activities needed to meet TPP expectations. And we are working in parallel on the TPPs with a plan to publish these later this year. For products with TRL 5 or 6, we expect manufacturers to apply their best efforts to achieve design lock and transfer to manufacturing within between the end of this year and latest Q2 of 2028. We expect to work with manufacturers to develop the validation and verification plans aligned with the intended use case, and also collaborate on the regulatory pathway towards regulatory readiness. I think a key difference with this RFP is we're not necessarily expecting manufacturers to register products in the target markets within the project timeframe, but we do want to work with manufacturers who are willing and capable to work towards regulatory readiness to support the sustainability and scalability of these activities going forward once the program has ended. So I think that covers the points on this slide, so we can go to the next slide. So I've gone over quite a lot of what we're expecting manufacturers to give us. So now I'll go over what you can expect from collaboration with the Supreme Secure program. We will be providing technical assistance. Concept Foundation specifically will be providing technical assistance towards technical documentation, verification and validation planning, regulatory strategy dossier preparation, all of those activities that I've gone over. We won't expect you to do in isolation. We'll be working hard to support you in those activities. Specifically for RFP3, we'll be funding and supporting, also with our partner, Burnett Institute, the multi-center clinical validation studies, plus the performance evaluation reports. And then specifically for RFP4, we'll be supporting late-stage development and design optimization, and again, validation and verification, potentially independent evaluation, depending on product stage gates and approvals. There are financial incentives available for manufacturers that are selected through this process. These will be subject to justification, and as mentioned earlier in the session, the whole selection process will be overseen by an independent review panel who will be ensuring transparency, fairness, and an unbiased selection. So alongside all the activities that we've already talked about, I think it's important to talk about the overall expectation of collaboration with manufacturers. We hope and expect to establish a joint project team with you and your team and work closely with you over the next 4 years. So this will include regular progress reporting on the activities that we've agreed between us as part of this process. As already mentioned, enabling and supporting on-site quality audits where needed, as well as financial forensics audits where applicable. And we expect partners to commit to transparent, affordable access pricing. The commercial side of this work is extremely important to ensure sustainable and scalable outcomes of the program. And if you are working with other funders that are supporting similar activities, we expect to be able to, for you to be transparent about that so that we can avoid duplication of efforts and maximize synergies. Next slide, please. Coming to the practicalities of this RFP, of both RFPs, both are exactly the same in terms of what you're expected to submit. We've tried to make it as simple as possible, but at the same time as we expect a number of applications, we need to be as thorough as possible to be able to be as fair as possible in our selection process. So when you are submitting a proposal to the to this either RFP or both of them, if it's applicable to your product portfolio, you need to make sure you scroll right down to the bottom of the RFP document where there are 4 annexes that need to be, well, there's 3 annexes that should be signed and submitted as part of your proposal. The 4th annex is the most important part of the proposal, which is the Excel questionnaire. So we ask all manufacturers to review this questionnaire in depth and complete it as much as you can. If manufacturers require confidentiality agreements to be put in place, if we don't already have them with you, please do reach out to let us know and we can work on facilitating that. But essentially all of the information in your proposal will be centralized in the questionnaire, and then you just need to sign the 3 forms, the declaration, quality audit agreement, and financial forensics audit. We require all manufacturers to submit their proposal by Friday, the 7th of August. And you are required to submit your proposal to our dedicated RFP Diagnostics email address, which is here on the screen, but it's also in the RFP document and on the RFP webpage. And we request manufacturers to clearly label their proposal. So which RFP you're responding to, the name of your organization in the subject of the email. Next slide, please. Coming to how we're going to evaluate the proposals and what criteria that we will be employing as we do this. We'll primarily be focusing on technical criteria. So within this, looking at assay performance parameters, operational parameters, manufacturing capability and capacity, proposed regulatory strategy, any prior experience and quality track record, and overall proposed timelines to ensuring that these are within the program limitations. We'll also be looking at financial criteria, so access pricing proposed by manufacturers that needs to be in line with target country expectations, also associated terms and supply conditions in target markets, and we'll be looking to discuss with you volume-based pricing schedules or procurement terms offering better value for money. If any of this information can be provided in the questionnaire ahead of time, that is extremely helpful for us as we process these proposals, and we encourage you to share as much as you can. And again, bringing it back to confidentiality, if confidentiality is a barrier to you providing information, please do let us know so that we can facilitate sharing of information and maximize chances of success through this process. Secondary considerations that we will be thinking about as well alongside the technical and financial criteria are environmental and climate smart manufacturing practices. If this is something that your organization is thinking about or starting to implement, we would be very interested to learn more about that. Any opportunities for regional production, particularly on the continent of Africa, and then whether your organization or company employs any gender-related policies, including across the leadership and workforce representation. As already mentioned, but just to be very clear, awards and selection is contingent on evaluation outcomes, may be subject to quality and financial audits, and will be overseen by our dedicated independent review panel. Unitaid also will be approving final selection of manufacturers. Next slide, please. So we are almost coming to the end of the presentation, and then we'll switch over to questions. But just to go over the timelines, overall, we expect this process to take approximately 2.5 months to bring us to the point of selected manufacturers. Starting at the top of this table, we're on the second row today, conducting the information session. The next deadline to consider is the proposal submission deadline. There are no deadlines before that. All manufacturers are welcome to continue to ask us questions via our dedicated email address, and we will be regularly updating the frequently asked questions document and releasing that on the dedicated RFP web pages. So to ensure that all manufacturers have access to the same information. Once manufacturers have submitted proposals following the 7th of August, we'll be going through a rapid evaluation process and then shortlisting manufacturers. We aim to notify manufacturers who are shortlisted by the 21st of August. And then following on from this, for a period of about a week, we'll be conducting one-to-one manufacturer meetings. These dates are subject to change. They may shift by a few days or a week here and there, but roughly speaking, this is our plan. We expect to, we're going to be asking shortlisted manufacturers to submit revised RFP responses no later than the 11th of September. This may not necessarily mean resubmitting the questionnaire, for example. It might just require submission of specific documents or files or data or additional information to add more information to your proposal that you've already submitted. And then we're aiming to select manufacturers by the 25th of September and let manufacturers know. Okay, you can go to the next slide, please. So finally, coming to the questions that we have received, I'm going to run through question by question. You can see here on the screen the focus areas that we have received questions about, which includes product of eligibility and intended use, the scope of activities covered by the Supreme Secure program, demand forecast for target countries, and also eligibility criteria. So far, I think we've received five questions. So I'll go through those questions and run through the answers to those questions. So hopefully, and these are all questions asked by yourselves as you registered. So hopefully colleagues that ask questions are here listening in and can hear our answers. We will also be updating the FAQ documents with these questions, so you can also review the answers afterwards. So the first question we received was focusing more broadly on the fact that we're looking at both preeclampsia and anemia diagnostics under Supreme Secure. The question specifically was, are two tests for preeclampsia and anemia linked together, and would only one manufacturer be awarded? We appreciate this question because we recognize that this can be a complicated process and a complicated set of information that we have been sharing with you all through the RFP and the broader information about the program. So the simple answer is no. Preeclampsia and maternal, the preeclampsia and maternal anemia work streams under Supreme Secure are being undertaken separately, and they are considered separate product areas within the program. The two preeclampsia RFPs currently released are independent calls targeting different use cases, as we've been through today, and technologies, and manufacturers may apply for each of them individually or both, assuming you meet the eligibility criteria that is set out in the RFP. So hopefully that clarifies on that point. The second question focused on development, registration, and market access activities. So specifically, the question was, under this project, in addition to the development, registration, and early supply activities, will there also be an opportunity for long-term supply agreements to be signed? So the quick answer is, at this point in time, it's unclear, but there could very much be the opportunity for this. The primary focus of the program is to support product development where applicable, and all the evidence generation activities that I've referred to, and market access activities. The RFP process does not guarantee future procurement volumes. However, there is significant market shaping activities planned under Supreme Secure that are designed to facilitate scalability of the work that we're doing and also sustainability. So really ensuring that the products that we're working on can enter markets and stay in them. So that is the broader goal, but we cannot guarantee at this stage that long-term procurement will be provided to manufacturers who are successful through the RFP process. The third question focused on demand forecasting, specifically asking how many diagnostic kits would be required for the Tanzania market. So to answer this one, at this stage, there are no country-specific forecast volumes that we are providing, including for Tanzania, but the program, and specifically CHAI, is undertaking market assessments in all 5 target countries. And we'll be working closely with manufacturers on commercialization and market access planning. We expect manufacturers to be able to demonstrate an ability to supply sufficient quantities for planned studies, and we can share that information in more detail as we go through the process. And we also want to see the capacity to scale production to meet qualified procurement orders. And again, we'll be working closely with selected manufacturers to put more numbers behind that statement. We do expect to be able to share detailed demand forecast, procurement volumes, and country introduction plans as the program progresses. So that information will be coming, but at this point in time, we are not yet sharing it. The last 2 questions were more focused on eligibility. So the first was from a company in Germany asking whether they're eligible. The answer is yes. The RFPs are open to all eligible suppliers that meet the technical, quality, regulatory, financial, and manufacturing eligibility criteria that's described in the RFPs. So please just review that in depth to ensure that you are eligible before you submit. There are no restrictions based on the country of incorporation or the manufacturer location. So similar to this question, we also received a question around whether university or academic departments working on technology development can apply. This will depend on the technology readiness level, and whether there is a credible plan towards manufacturing and regulatory approval and all the downstream activities that would be needed to ensure product can enter market. So it will depend on you as what you're able to bring to the table. If you're a university and you're interested to apply, we do encourage you to apply. And if this answer hasn't provided sufficient feedback, please do follow up by email, and we'd be happy to share more information. But we do encourage all partners that could be eligible for putting products into markets to apply. That concludes the question and answer portion of the session. And I think that means we can move on to the closing. So if you can go to the next slide, Caroline. I think that's actually, yeah. You can go back to the last slide, Caroline, and then we can move to closing. Ah, there we are. Thank you. So first and foremost, we would like to thank you all for taking the time to join this information session. And we encourage you, as I've already said, to review the documentation and the Excel questionnaire in full, and select the RFP that best fits your product maturity, intended use, specimen type, and the planned activities that we plan to undertake. Please do feel free to submit any questions you have via the email address, our dedicated email address. And again, a big reminder that the submission deadline is Friday, the 7th of August. So once again, we thank you for your interest in partnering with Supreme Secure, with Concept Foundation, with CHAI and the rest of the consortium partners. We'll be posting the recording of this session online and updating the FAQ documents rapidly, and encourage you to keep asking us questions. And we look forward to your proposals if you meet the eligibility criteria, and thank you once again for your consideration. All right, I think we can close for today. Thank you all, and we look forward to receiving your proposals. Goodbye.